Congestive heart failure is a very common disorder found in the medical field. In fact, there are currently more than 2 million cases of congestive heart failure in the United States. Not only that, but there are an additional 500,000 people in the U.S. that are diagnosed with CHF each year. Congestive heart failure has a deceiving name. Most would assume it is the complete shutdown of the heart's ability to produce its own automaticity, conduct electrical impulses throughout the heart, and stops the heart from contracting. This would be more along the lines of cardiac arrest. However, congestive heart failure is a malfunction in the heart's ability to pump blood powerfully and fast enough throughout the heart. This is a severe problem when it comes to maintaining homeostasis in the bodies of individuals. The result of the heart's inadequate pump functions is a backup of blood in systemic circulation. This is detrimental, so much so that in fact half of the people who are diagnosed with severe CHF die within a year of that diagnosis. So why is it that blood backing up in the systemic circuit takes such a huge toll on the human body? When blood backs up in the heart vessels, the pressure is increased in the capillaries. This causes fluid to transfer from the intravascular space to the interstitial space. Where this fluid ends up is completely dependent on which type of congestive heart failure the patient is dealing with. There are two different types of congestive heart failure. This is left-sided heart failure and right-sided. Both of these conditions are similar in regards that the blood is backing up into the systemic circulation, but each has its own presentation. The best side of congestive heart failure, if there can be a best side, is the left-sided heart failure. Left-sided heart failure, congestive heart failure, is much more common than the right-sided version. So left-sided congestive heart failure, of course, affects the left side of the heart. More specifically, the left ventricle. In the event where the left ventricle is unable to pump blood out of the heart quickly enough, with enough force, the blood will begin to pull up in the left ventricle. As the blood pulls up in the left ventricle, this causes pressure to build up in both the left atrium and into the pulmonary veins. This pressure eventually backs up and causes serum to be forced out into the alveoli due to the thin membrane of the capillaries. The serum mixes with the air in the lungs to form foam, which is known as a pulmonary edema. Fluid will also leak into the interstitial space of the lungs. This is not particularly good for the heart that was already unable to pump adequately. Duh. It's not good for it. No. It's bad. It's bad for the heart. It's bad. As pressure increases in the interstitial space, it causes the bronchioles to narrow. The narrowing of the bronchioles and the accumulation of fluid in the lungs forces the body to increase its work of breathing, which naturally, in return, increases the workload on the heart. It doesn't stop there. The body's reaction to the shortness of breath or trouble breathing is the production of epinephrine from the adrenal gland. Epinephrine does cause bronchial dilation, which one think would help, but epinephrine also causes vasoconstriction. By shrinking the diameter of the vessels in the heart, vasoconstriction increases the afterload of the heart. Afterload is the amount of blood the left ventricle has to push against, subsequently increasing the workload of the heart as well. The body also reacts to the heart's inability to pump blood throughout the body by releasing aldosterone. This hormone normally functions to help the body retain fluids in times when it is necessary. It acts directly on the kidneys to reabsorb electrolytes, most important of which in this solution is sodium. Sodium is known to suck. What this really means is where sodium goes, the bodily fluids are likely to follow. This reaction causes an increase in circulating sodium. When this blood has a high concentration of sodium, it moves through the circulation back to the pulmonary veins. This increases the capillary pressure so high that it forces blood into the alveoli. This increase in sodium levels causes even more fluid to move across the alveolar membrane, so it has such a strong effect on the movement of fluids in the body. Patients with left-sided heart failure suffer very traumatic symptoms. Patients Traumatic, huh? Patients with left-sided heart failure typically will be very frantic due to their air hunger. Get it in me, I need it. It is not unusual for patients with severe left-sided heart failure to be combative against the rescue team. These symptoms can be related to hypoxemia and poor perfusion of the brain tissue. This can cause the patient to be confused or disoriented. These symptoms are the after effects of pulmonary edema and bronchial constriction. It is easy to identify both of these in patients just by simply listening to the breath sounds of said patients. Patients with pulmonary edema will have lung sounds that sound like crackles. I'm assuming that means patients with pulmonary edema will have lung sounds that sound like crackles. This is due to air bubbling through fluid-filled alveoli sacs. If wheezing is heard in these patients, this is caused by air flowing through narrow bronchioles. Left-sided congestive heart failure can have many different causes, most of which that deal with diseases that damage heart muscle. A very common cause of left-sided congestive heart failure is an acute myocardial infarction. In the case of an acute myocardial infarction, there is a likely chance that part of the heart muscle can be damaged. For instance, in the case of an anterolateral or septal myocardial infarction, coronary vessels on the left side of the heart are occluded. This prevents blood from reaching muscles on this side of the heart. Without blood, these segments of the heart will begin to deteriorate to the point of death. This is because cells in these regions are unable to receive oxygen that they need to survive. If the cells are damaged or die, the muscles in the heart will be unable to perform their duties efficiently, leading to poor cardiac output. Another reason people develop left-sided congestive heart failure is chronic high blood pressure. If a person lives on a daily basis with high blood pressure, the left ventricle has to work harder and harder to pump against the growing afterload. At the same time, the right side of the heart is still providing the same amount of preload. This kind of strain on the left ventricle eventually takes a toll. When treating severe cases of left-sided congestive heart failure, it is important to first provide 100% supplemental oxygenation in order to help improve patient oxygenation. It is preferred when administering oxygen that it is done through a bag valve mask with positive and expiratory pressure, or with continuous positive airway pressure devices. These devices actually help push fluid that is built up into the alveolar sacs to move across the membrane back into circulation. Get back in there! You silly little fluids, you get back in there right now. The CPAP device also increases the surface area of the affected alveoli, allowing for a greater amount of gas exchange to take place while administering oxygen via CPAP or VBM. You know what I mean. It will help patients to administer 4 milligrams of nitroglycerin sublingually. Nitroglycerin acts as a vasodilator. This will allow for more fluid to be pushed from the alveolar sac back into circulation. This will also increase the amount of venous pooling throughout the body. CHF. Decreasing venous return will decrease the work demand on the heart, which will decrease the oxygen demand of the heart. Another drug that can be used in the treatment of congestive heart failure is digoxin. Digoxin is a cardiac glycoside that increases the inotropic effect of the heart. Increasing the force in which the heart contracts increases the heart's cardiac output. This in turn decreases the capillary hydrostatic pressure around the alveoli. Lastly, patients with congestive heart failure can receive furosemide or Lasix. Lasix is now a last-line drug in the treatment of congestive heart failure. It acts on the distal tubules of the kidneys to prevent reabsorption of sodium. Preventing reabsorption of sodium increases the secretions of fluids from the body, decreases the amount of fluid in circulation, decreases the work demand on the heart. Right-sided congestive heart failure is not as typical as left-sided. According to Nancy Carolyn's book, Emergency Care in the Streets, quote, right-sided congestive heart failure by itself is seldom a life-threatening emergency, unquote. Unlike left-sided congestive heart failure, right-sided congestive heart failure occurs when blood backs up behind the right ventricle. This causes an increase in pressure in the systemic veins, which causes them to become engorged. Much like left-sided heart failure, after a while of the vessels being engorged, they will begin to release serum into the surrounding tissue. However, where the serum ends up is different than left-sided heart congestive failure, or congestive heart failure, or failure congestive heart, whichever order you want to go with, it doesn't matter. Patients with right-sided congestive heart failure present with edema in various regions of the body. A common location for edema to be observed is, of course, in the extremities of the legs and feet. There are different cases, however, when patients are bedridden, and edema is more noticeable in the lower back. How about that? In some cases, edema caused by right-sided congestive heart failure may not be visible at all. If palpation to the liver of the patient and they complain of pain, it is very likely that there is swelling to that organ due to edema. Also, in the text it mentions, quote, right-sided congestive heart failure can also cause fluid to leak back into the peritoneal cavity, causing abdominal distension, unquote. This can be easily felt by palpating the abdomen. Right-sided congestive heart failure is something or another. Is most of the time a direct result of left-sided congestive heart failure. The plot thickens. This is due to the increase of blood that backs up into the left ventricle and pulmonary vessels. This increases the workload on the right ventricle until it too begins to fail. This can actually be beneficial for left-sided heart failure since it decreases the amount of blood that the right ventricle can pump to the left side of the heart. Some other causes of right-sided congestive heart failure include respiratory disorders such as COPD, chronic obstructive pulmonary disease, or pulmonary embolism. The increase in pressure of the pulmonary vessels requires the right ventricle of the heart to use more force until it begins to experience failure. Paramedics will encounter CHF patients quite a bit due to the fact that the average age of the people they will interact with is normally going to be greater than 50 years. There is also the fact that there is now a rising population of old people, which is due in part to better medications helping them artificially live longer than before. Which is due in part to better medications helping people live longer than before. Due to increasing interactions with CHF patients, paramedics will have learned how to deal with CHF and what they can do for their patients. In an ambulance, there is not much paramedics can do to help treat left-sided heart failure, so they treat the symptoms. To treat the respiratory symptoms, they are going to give the patient 100% supplemental O2 and put them on CPAP. Love that CPAP. It's so great. It's so much better than pharmacological methods. I think CPAP is cool. They might also give nitroglycerin to help cause vasodilation to help get rid of some of the fluid in the lungs. The last step the paramedic can take is to give them Lasix, but it is not usually given in an ambulance unless the transport time is greater than 30 minutes. Also helps if they have a Foley in place. If they know what to normally expect in a patient with heart failure, then they can make sure that there's nothing else life-threatening going on. This can also help them from misdiagnosing a patient with something else due to the symptoms caused by heart failure. Patients with left-sided heart failure usually have a sedentary lifestyle because they cannot tolerate exerting themselves due to the inability of the lungs to provide adequate oxygenation. And there's the catch-22. You're lazy, and you don't like to move around, then your heart gets bad. But when your heart starts to get bad, you can't move around very much because your heart's bad and the lungs can't do stuff. And so, it's just come full circle. Anyways, they are usually able, or no, they're usually on home oxygen and have a specific diet, such as low sodium, to try and reduce fluid retention. Knowing how the patient has to deal with their CHF can help you anticipate what they're going to present like. When left-sided CHF patients present to paramedics, they usually have difficulty breathing, even on their home oxygen. They could sometimes present with ascites due to the fact that most people who have left-sided CHF also have right-sided CHF. Patients do not stick to the dietary regulations, usually end up with edema due to increased fluid retention because of the sodium, because chips, because McDonald's. You get the idea. Patients will also usually not be very mobile due to their inability to tolerate exercise and or exertion. So in conclusion, congestive heart failure, being the common disorder it is, presents differently given that it has two different types, left-sided and right-sided. Left-sided is the more common and dangerous form of heart failure. Right-sided heart failure does exist. However, it's important to keep in mind that right-sided heart failure usually presents in addition to left-sided heart failure. Generally, heart failure is a condition of decreased pump function, which results in fluid buildup. So, the treatment of heart failure is, focused on increasing the pump function of the heart so that it can move that fluid around and get things back on track to where they should be. So yeah, congestive heart failure. Be cool, stay in school, don't do drugs.